Good morning, colleagues. This is Istiaque from UNHCR Sub-Office Cox's Bazar. Today, I would like to talk about protection mainstreaming and protection monitoring with you. As we all know, protection means ensuring rights of the refugees. So, whatever we are doing, we all are working as protection officer and trying to ensure rights of the refugees. Let's talk about protection mainstreaming. Protection mainstreaming is a process of incorporating protection principles in our work. At the same time, it also ensures that rights of the refugees are protected, their safety and dignity are ensured in our work, and we are ensuring their meaningful access to our services. So let's see how we discuss further about protection mainstreaming. Protection mainstreaming is a process which is applicable for all humanitarian workers. So you can be a health worker, you can be a shelter officer, you can be a wash officer, but you need to do your work in line with the protection principles. This is the key element. It also talks about that protection principles need to be followed throughout the project cycle. So when you are planning or when you are implementing or evaluating our projects, we need to keep in mind whether the work was done in line with protection principles or not. And personally, I find it most important that we need to all keep in mind that it's a process that is important. How we do things, that is important. Not only what we do, we can do our work, we can be super smart at our work. However, if we don't focus how we are doing our work, we might bring unintended harm to the people for whom we are working. So there are 4 key elements of protection mainstreaming. Number 1, safety, dignity and no harm. It means when we are working, we need to make sure we are ensuring the refugees have safety, we are treating them with dignity, and we are doing in a way that we don't bring any unintended harm in their life. We need to make sure they have meaningful accesses to our service centers. For example, if you build a hospital on the top of a hill, you don't expect persons with physical disability or elderly or children to climb that hill to access the health services. So we need to make sure they can access our services properly without any difficulties. We need to keep in mind number 3, accountability. Accountability is very important. We all know about accountability to our organizations. We also know about accountability to our donors or the host government. However, we often forget that we are also accountable to the refugees. So we need to make sure there are procedures in place to ensure accountability, not only to our officers, to the refugees as well. We need to also ensure participation and empowerment. Refugees should be part of the process of our planning as well as implementation. They're in the best place to tell us what are their problems and what we should be doing as well. We can take their suggestions through which we will empower them, which will help them in eventual voluntary repatriation to their country of origin. In that situation, they will be able to take care of their own life without any external support. Now, let's talk about protection monitoring. Protection monitoring is a process in any refugee context through which we collect, verify and analyze information in order to identify violation of rights of the refugees and protection risks that they are facing in order to find effective responses to those challenges. So through this process, we identify the issues. At the same time, we try to address those issues. There are different tools of protection monitoring. Today, I will briefly talk about some of the tools. The first and most important tool is protection by presence. You see in the camp there are different protection workers. They are going to the camp and often you don't know what they're doing. What we say is that the mere presence of a protection staff is one of the most important tools, is protection by presence. So the refugees know they can approach us whenever they need. And we go on the block level, we go and talk to people to identify their problems. What we also do, we do household visits. We visit houses, try to find their problems and try to address those problems. Sorry. We also organize focus group discussions with different groups. It can be divided by age or gender or by specific needs. We try to identify the problems of that particular group is facing, their challenges. We try to identify and address those challenges. So they can also freely talk about their problems, which they might not do in a larger group. We do organize individual protection assessment to identify problem of an individual and to address that individual's problem. We also do larger protection assessment. It can be done in a block level, it can be camp level or several camps depending on the situation and the issue. We do other protection assessment as well. We do conduct community meetings to identify the problems of the community and what they can do to address those challenges. So community meeting is also very important. It allows us to engage with the community and build a trusted relationship with the community. We conduct interviews, not only refugees as well as of partners as well as government authorities and other stakeholders who are working in the camp. It allows us to take their views and to improve the work that we are doing. We collect data and verify those data, and then we plan our responses based on those data through our protection monitoring. We also do what's very important, establish a trustful relationship with the community, establish contact with them so that they can also contribute in improving their life. Let's talk about the COVID situation. How are we conducting protection monitoring during COVID? Well, as you know, due to the restrictions imposed by the government, we have reduced the number of staff going to the camp and number of days they are going to the camp. So the protection focal points are going to the camp once in a week, and they are meeting refugees, stakeholders, partners, government authorities, and they are also trying to respond to the urgent needs of the refugees during that visit day. The other days they are in touch with all the actors in the camp, refugees and other stakeholders through phone and other communication channels. Let's talk about what is the role of the partners and the volunteers. Well, the protection partners are also going to the camp on a rotation basis every week, and they are also ensuring services to the refugees. When they are not in the camp, they are receiving referrals over phone and they are responding those needs when they are present in the camp. The role of the refugee volunteers. The refugee volunteers are playing a very critical role during this time specifically. They are playing an important role throughout the year, but this time during COVID, when we are not present in the camp every day, they are playing a very critical role in identifying problems, referring them to service provider, informing the service provider, as well as they are also assisting to provide services. So they are playing a very critical role in the camp. Let's talk about what are the challenges we are facing during COVID. Well, as you know that a gap of the presence of protection staff every single day the way we used to be doing before, it has an impact, and it has negative impact as well in the camp. So what we have seen so for last 3 months that a number of domestic violence has increased in the camp, and one of the reasons behind it is lack of protection staff in the camp. There are many other reasons. For example, the people cannot go out, they're stuck at the home, which links with frustration as well. But lack of protection staff's presence is one of the main reasons why we are seeing different challenges are increasing in the camp, and we are trying to address those challenges. It's difficult to communicate all the time over phone and to address all the issues over phone, so we have to depend on the days we are going on rotation to the camp. So we are utilizing the whole time in the camp to address those challenges. Let's talk about addressing mechanisms in the camp. We have protection focal points, one in each camp assigned by the protection sector who are responsible for their camp. They are working with the protection partners in the camp, and then they are working with the GVV and CP subsector focal points closely. There are referral pathways in the camp through which you can make a referral of a protection case if it's a general protection legal assistance, or it can be CP case, it can be HGV case. So you can make those referrals using the referral pathways. We have UNHCR's toll-free hotline, which is operational 24/7, and refugees can call that number from all the camps and report any emergency protection issues. The number is 16670. We also have complaint boxes in the camp. You can find it in the information hub or the CIC complexes. We also have PERU, Protection in Emergency Response Unit. They are deployed during any emergency response in the camp. They are combined of one general protection staff, one CP, one SGV, one community mobilizer, and 2 refugee volunteers. We have the protection coordination forum, last but the most important one. The protection sector takes decision at Cox's Bazar level, and the protection coordination forums at the camp level, led by protection focal point, implement those decisions, as well as they bring back information and issues from the camp to Cox's Bazar level. So colleagues, this is all from my side. Thank you.